During this episode, we sit down with Dr. Holly Urban, Vice President of Clinical Product Design at Clinicomp, pioneering intuitive EHRs to combat clinician burnout. Bringing deep medical expertise, Holly is driven to create the right tools so clinicians can deliver better care. While together, Holly shares how Clinicomp is building a new system focused on streamlining workflows for modern healthcare's digital age, and how her company is leveraging the latest innovations around AI and automation to further accelerate documentation and administrative efficiencies. We also discuss the future of increased EHR competition and innovation in a mature yet dissatisfied market. Join us as Holly advocates for technology that lets providers practice medicine rather than data entry, and to hear her dedication to improving care through thoughtful design. Let's go.
Welcome to Passionate Pioneers with Mike Biselli, where we highlight and speak with the innovators, the game changers, and the pioneers who are deeply passionate and relentless in solving the problems our world is facing today. This is your opportunity to connect with and learn from these leaders and to support them on their mission. Perhaps they will soon be hearing your story as well. This is Passionate Pioneers with Mike Biselli. I look forward to having you on this journey with us.
Hi, Dr. Urban. A big welcome to our podcast today.
Hi, Mike. Thanks so much for the opportunity to chat. I'm looking forward to our conversation.
Well, given your expertise in clinical product design and healthcare informatics, coupled with your passion for improving patient care through cutting-edge technologies, I'm eager and excited to have our conversation today. But before we dive in, a bit of housekeeping. While listening to any of our episodes, please take a moment to subscribe to the podcast so you will automatically receive episode updates in your podcast player. Simply search Passionate Pioneers with Mike Biselli in Apple Podcasts, Spotify, or wherever you listen to your podcasts. And lastly, please visit the bottom of the episode notes to connect with me on LinkedIn and Twitter in order to further the conversations occurring on this podcast. All right, Holly, it's almost time for our community to learn how you and the Clinicomp team are combating clinician burnout by building a new EHR with intuitive workflows for a modern digital age. But first, what's that one piece of advice that you would give to others who are passionate about reimagining the health of our world?
Well, I'd say that we need to be thinking broadly around why we have to fix healthcare. I mean, you think about the U.S. spends more in our GDP of up to 19%, and yet we have worse outcomes. You know, we have falling life expectancy in the U.S. as opposed to other nations. So there's a lot to fix. The lens that I bring to it is how can we have the electronic health record give the right tools to clinicians, nurses, doctors, so that they can do better care for patients and we can start bending that cost curve and seeing better outcome for patients. That's what wakes me up in the morning, is making sure that our clinicians have the right tools to take better care of patients.
I mean, you're spot on, Holly. It is mind-blowing to think about how much of our GDP is spent on one industry. And then to your point, you couple that with outcomes on a global scale. And to think that, you know, our country is not even in the top 5, top 10, it's pretty eye-opening. And it should be incumbent on all of us who have dedicated our careers to this industry to go out there and fix it. And here's, from my perspective, Holly, you know, if we as a country could put a man on the moon collectively 50 plus years ago as a nation, there's no reason why we can't go and reimagine and fix this industry that literally touches every single one of us. Holly, has that been something as well from your perspective? Thinking broadly, how do we get to the core issue at hand of that outrageous spend, runaway spend versus outcomes? Has that been fuel for your fire even beyond? And we're going to dive into it later about what all the good stuff you're happening at Clinicomp, but has that been a fire for you throughout your career as well?
Yeah, absolutely. I mean, unfortunately in healthcare, in order to solve this big problem, you have to follow the money. And in order to follow the money is you have to understand the market. So at Clinicomp, we're diving deep in revenue cycle, understanding the pressures that payers are putting upon providers and in terms of complex payer contracts and building software to help support so that they can get reimbursed. I mean, it's not sexy, it's not glamorous, but it certainly is critically important for the financial health of our healthcare systems, because if they don't have revenue, then they can't take care of patients. So that's something, you know, we're really laser focused on the clinician journey, making sure that the end user experience helps them, as I said, with patient care. But we also know we have to pay attention to back-end processes too, to make sure that they're maximizing revenue so that they can continue with their mission.
Well, yeah, there's a lot there and there's much more to discuss. And I can't wait to dive into this important conversation, Holly. We have a lot to cover today. We're going to dive into all of that and more and all the good things happening within the Clinicomp team. We're going to get after it right after we get back from thanking our community champion sponsor.
Located in Denver, Colorado's nationally ranked River North District, Catalyst is a healthcare innovation campus that brings together stakeholders from across the industry to accelerate innovation and drive real, lasting change our nation desperately needs. From established organizations to startups, from accelerators to advocacy organizations, and from medical schools to global companies, everyone at Catalyst works side by side to create, develop, refine, and bring to market cutting-edge innovations that will fundamentally transform healthcare as we know it. With industry leaders like Medical Group Management Association, Olive, Medical Solutions, UC Health, CirrusMD, and many others calling Catalyst home, along with innovative pioneers visiting from across the nation, Catalyst continually fosters their foundational belief that collaboration and partnerships will move the healthcare industry forward. To virtually tour Catalyst and claim your space on campus or host an upcoming event, visit catalysthealthtech.com or visit the top of the episode notes and click on their link.
All right, we are back with Dr. Holly Urban, Vice President of Product Management at Clinicomp. Holly, thank you so much for joining up today. Really excited about this conversation. We have a lot to cover. Of course, Holly, you are a new entrant into the Clinicomp family, newer, if you will. We're going to talk about your journey leading up to being an executive within the Clinicomp team. And of course, what you guys are working on today, the success you're having, how things are going in the marketplace, that receptivity, that, the feedback you're receiving from those end users. And then we, of course, need to look at a little future state, grab that crystal ball off the shelf, talk about what you're seeing down the road here and what we need to be thinking about as a community rallied around this podcast. And of course, how we can be helping you in the Clinicomp team as well. But of course, Holly, let's first start. How did this all come to be in the first place? You've had a storied career. Take our audience a little bit behind the scenes of how you became part of the Clinicomp executive team. How did this all come together in the first place?
Well, I've been in healthcare a long time. I went to medical school right out of college and was a practicing pediatrician for many years. And this is when the new era of healthcare information technology and EHRs was dawning. And I recognized the power of EHRs to really help provide better patient care at scale. So instead of me taking care of one patient one by one as they're sitting in front of me, like I said earlier, if I could create the better tools to help providers take better care of patients, then I could be improving healthcare at scale. So that's what led me into healthcare information technology. It's been about 15 years. Have worked at 3 different electronic health record vendors now in product management in opportunities. And in product management it allows me to help design software. So with that provider lens, making sure that what's important to them from a workflow standpoint, from a content standpoint, from leveraging the evidence to making sure that they're doing the right thing for their patients, that's allowed me to be more involved helping make those decisions around what's best strategically to help that very important constituent. So I started my career at McKesson Horizon Clinicals, which is an electronic health record vendor that is no longer around, unfortunately. I then worked at 2 evidence-based companies that were under the Hearst Health umbrella, Zinx Health, which does evidence-based order sets, and MCG, which does evidence-based medical decision guidelines. And that was great for me because one of the power, I think, of electronic health records is to get clinical decision support that is evidence-based into the hands of clinicians. So then I was able to marry that background when I became CMIO at Oracle Cerner, and then from CMIO as Chief Medical Informatics Officer. And then I was at a retirement party from someone I worked with at McKesson back in the day. And she said, "Hey, I work at Clinicomp. We're building a brand new EHR from scratch, and we're looking for a VP of product." And I said, "What? Well, that's kind of amazing." So one thing led to another, and I joined Clinicomp on this journey to build a new EHR, and it's really an exciting time for the company.
Isn't that amazing? You go to a retirement party, and all of a sudden, here you are thinking about, oh my goodness, what an exciting opportunity to build a new EHR. Very, very cool. In regards to where you guys are today, we're going to talk about that. Of course, I want you to share with our community who Clinicomp is and why you guys are going about what you're up to. But of course, we're going to come back to it as well. I think one of the big parts, and it was just teeing it up on the front end for you, Holly, is around this notion of combating clinician burnout versus an EHR. So we're going to talk about that in just a moment, because that is, as you know, a very, very important topic in today's age, especially coming out of a pandemic. But how we define that TBD. But of course, let's first start there, Holly. Who is Clinicomp? And then we'll go from there and talking about the clinicians and how you're best serving them.
Well, Clinicomp is not a new company. We've been around for 40 years. We had clinical documentation systems primarily for high acuity settings like ICUs and PACUs. And we have a lot of device integration where we can natively capture data from ventilators and from ECG machines. And so we've been in that space for 40 years, primarily with federal clients. When those federal clients decided to go in a different direction in terms of going to a public bid and wanting to be on one system, my CEO at the time said hey, I want to go ahead and build a new EHR to go after the commercial market. So we leveraged our strengths that we already had from 40 years in the clinical documentation space and then are building a full-fledged EHR around it. So like I said, it's been quite a journey. Most of the EHRs that are out there have been around for 20, 30 years. And so to have us stand on the shoulders of some of these giants and with the lessons learned over 20, 30 years of implementations to say, hey, how can we do it better so that it better serves the clinicians and then ultimately better serves patients? That's really what's been exciting to me about working at Clinicom.
Very exciting. Thank you for setting the stage there, Holly. So let's go there. You teed me up perfectly. In regards to better serving the clinician, they have been through a lot these past number of years, and they were already going through a lot even before COVID-19 came knocking on all of our collective doors. How is this helping with clinician burnout? Where are you guys seeing that kind of white space, if you will, that opportunity that wasn't in the marketplace with some of those established vendors, if you will? What are you guys doing to deliver exactly on that?
Yeah, I don't think you can understate the importance of clinician burnout. You hear providers, and I have my friends who I've known forever who talk about feeling like they're data entry clerks in an electronic health record, that it's just very transactional. There's a lot of regulatory and documentation burden that's dumped upon the clinician, none of it really providing better care to patients, but all just required either for payment or regulatory or other reasons. And so there's been a huge market swell of, broad recognition from providers that we need the EHR to work for us because we don't want to work for the EHR. So as an example, the American Medical Informatics Association has an initiative called the 25x5 Project, where they're looking at how to decrease documentation burden, whether it be through provider notes or prior authorization or other areas. And AMIA, the American Medical Informatics Association, has been very open to having vendors involved. And so they have a vendor work stream working on this 25x5 documentation, which I serve on. We talk a lot about what can we do tangibly to help the providers and other clinicians really reduce documentation. And again, the excitement is, for me at Clinicomp, I don't have to go back to an old UI that was developed 20 years ago or 30 years ago. I can say, hey, how can I create the UI today, knowing what provider workflows are like, and make it intuitive and make it easy to use and decrease those, automate any of those sort of onerous documentation burdens in a way so that it makes the system just much easier to use.
Well, to your point, right? You guys aren't shackled to status quo or, this is how it's always been done, right? You guys can think anew at Clinicomp, and I love that. But of course, things are moving quite rapidly in regards to technological innovation. It's always been moving fast, but it seems like it's even quicker today, and more specifically around automation, around AI, around predictive. And some of those terms, of course, and I get it, are a little bit of a boogeyman, a little scary to some of our friends in the healthcare industry. Again, totally understandable. But are those things that you and the Clinicomp team are taking into account? You just mentioned it quickly about automation, but some of those, buzzwords, if you will, AI, automation, predictive, are those part of the roadmap to better serve and help our clinicians to decrease that burnout, of essentially, as you mentioned, data entry? Are those parts of the puzzle as well?
Yeah, it's been super interesting to me, the conversations at the 25x5 documentation burden, pre-generative AI and post-generative AI. That dialogue has changed quite a bit. And so Clinicomp, like all vendors, are really saying, this could be a total game changer in the way that we allow providers and other clinicians to be more efficient using the system. So how can we use generative AI to maybe get some of the more administrative tasks automated, like standard note creation, responding to patient messages and that come from the portal, prior authorization? There's just so much opportunity. But I always take, as a product manager, I always have to be very pragmatic about it. Generative AI is a tool. It is not the answer. You really need to evaluate it in terms of its strengths and its weaknesses. And, we hear about the hallucinations, and in the healthcare setting, that's absolutely not acceptable. You cannot have anything that isn't fully reliable. And I think there's going to be guardrails that'll come down probably from a regulatory standpoint, and that may help. But it's really an exciting period of discovery. And Clinicomp, like I'm sure all vendors are really evaluating it to say, how can we even go next level? Better UI is great, but automating tasks using generative AI is really going to accelerate adoption and acceptance of the EHR.
Well, let's continue to talk about the EHR and something that you just brought up, because I think it's important because we have to think about the different players in healthcare, right? It's a very complex, multi-sided marketplace, if you will. And one of those players in that multi-sided marketplace is the regulatory body that you just mentioned. And so when we think about, historically speaking, as you mentioned, when you think about an EHR and the input needed, a lot or some of that, I can't put a percentage to it, maybe you can, is driven by the regulatory environment of what is needed to be captured in order to do your job. And so how is Clinicomp balancing that, the regulatory need, the regulatory requirements of our providers versus trying to reduce those types of that burnout with EHR? How do you find that balance?
Yeah, it's a great question. I mean, I think, again, the advantage is I don't have a full-fledged system that a new regulation comes in that I need to retrofit, right? I'm aware of what the regulatory environment is up front, so I can make sure that any new workflows or any new regulatory are baked into the cake, and doing it in a way that doesn't feel bolted on like a legacy vendor may have to do just because it's new regulations, they've got an established system. We can design the system in a way that it's more inherent in the workflow. So one example is CMS very wisely changed how physicians do their billing. Instead of having, I need to have certain documentation elements to code for, it's now medical decision making. Well, that's amazing, because how can I help with some automation to say, hey, doc, you showed me that you looked at 3 different labs and you looked at 3 different radiology studies and you have your differential diagnosis is 5 diagnoses long. I can help you figure out what your medical decision-making is in order for you to assign a CPT E&M billing code. So again, it's that opportunity to do this stuff right out of the gate natively that I find extremely exciting. And again, I think very powerful.
And then also, thank you for that. That's perfect. In regards to, the notion of what a provider is or what is a health system, those are big terms, right? So you can think of large, health systems like a Kaiser or, name a massive system in the country. Or you can think of that, 1 or 2 physician location in a downtown anywhere USA, right? Who are the constituents that Clinicomp likes to serve? Is it ambulatory? Is it post-acute, acute? Who are the folks that you guys are working with and finding success with?
Yeah, it's a great question. And, one of the challenges in our industry is it's a very mature industry, the EHR. And so there's pretty large barriers to entry. We feel like we have an opportunity with smaller health systems that maybe don't have the finances or the revenue to sign a big check for one of the big vendors, for Epic, for Cerner. So we feel like for some of these smaller systems that are, maybe doing more indigent care or have a big Medicaid populations that they just don't have big revenues, that they maybe provide a better opportunity for us. But it's a gamble for these customers, right? We're new. Yes, we've been around for 40 years, but not in the full electronic health record space. So honestly, that's a challenge. And it's something, we're just continuing to have conversations with potential clients to say, what would it take for you to take the gamble and go with a brand new EHR from Clinicomp?
And let's talk about the ones that have partnered with Clinicomp in regards to your new EHR offering. What has the feedback been from those clinicians? How are they enjoying it? How are they using it? And how do they see this as being a differentiator for their day-to-day?
Yeah, so we're getting great feedback. There's a common process that EHRs have to support called medication reconciliation. We have an incredibly talented group of UX designers and clinical product managers who work together to create this super intuitive workflow that's very easy and quick. And, I worked at an EHR vendor where it took about 30 minutes to complete this process. And then with the new EHR, it takes less than 10, like 5 minutes. So that's huge when you're thinking about the day in the life of a patient, in the day of a life of a provider taking care of patients. So we're getting great feedback. It's very exciting.
Oh, I absolutely love it. Absolutely. I mean, one of our biggest assets that I always love getting more of is time, right? So always good to hear when you're saving our incredible clinicians' time. That's powerful. Let's now take the crystal ball off the shelf a little bit, Holly. Let's talk a little future state. Where are you seeing things heading on the macro for our industry over the next 2 to 3 to 5 years within this space? And of course, where do you believe Clinicomp's going to be in that future state as well?
Yeah, absolutely. So as I mentioned, the EHR in the US is a pretty mature market. Thanks to meaningful use, about 98% of hospitals have some kind of electronic health record. So I think the opportunity is some of these, like I said, smaller systems who are frankly dissatisfied what they're currently using and saying, is there another opportunity? I think everyone has recognized in our industry is that we have a couple of dominant players. And with this market dominance by 1, 2, 3 EHR vendors, where's the opportunity for innovation? So, when you have these dominant players, where's that startup that can do the innovation given the barrier to entry? And that's what I'm hoping that people will recognize, that there is an opportunity if you're willing to take that gamble to go with a smaller vendor as opposed to one of the big 2, 3 named vendors.
I mean, you're spot on, right? I mean, competition can breed, can create incredible environments for innovation and doing things at scale and doing it better, doing it cheaper, et cetera. So that is an exciting, point to bring up, especially in this, as you said earlier, a very mature space in healthcare. But we've seen it time and again, Holly. There are very, very many, quite a few unsatisfied leaders in our industry with what we currently have in front of us. And so let's start thinking anew. And it sounds like the Clinicomp team is doing exactly that. And so we'll put the crystal ball back on the shelf for now, because I agree with that 100%, Holly. Let's get back to current state. Of course, an amazing community rallied around this podcast. What's one problem, need, or question that you and the team have that our community can be helping you with?
Yeah, I think it comes back to that barriers to entry. So what does it take for a health system to say, I want to try something different. I want to try something new. I'm listening to my clinicians. They're not happy with the current system. I don't have the dollars to buy one of these huge vendors. I just can't afford the price tag. So, what's left for me? So that to me is, I would love to learn more about what would it take for one of these systems to go ahead and have that gamble, to say, I want to go with the innovative partner. I want to go with something that isn't one of these main market leaders. I understand how important it is, both for providing patient care, but also for a hospital from a financial standpoint, right? You can't take care of patients without a great EHR. You can't send claims without a great rev cycle solution. So what does it take to get over those sort of clinical and financial obstacles to go with a brand new vendor?
Well, with the community who wants that conversation with you, how do they get a hold of you, Holly? What are those contact points online, social media handles, websites, or otherwise? How do they get a hold of you?
Yeah, so you can connect with me on LinkedIn, Holly Urban, MD, MBA. I'm pretty easy to find. And of course, the Clinicomp website, www.clinicomp.com. So love to get the outreach, love to have conversation if anyone wants to go deeper on that.
And easy enough for listening community, just simply scroll on into the episode notes in your favorite podcast player to get a hold of those contact points for Holly and the Clinicomp team, or you can head over to our free global online community at passionatepioneers.com. There will be a post for Holly's episode, as well as an area to leave comments and suggestions or otherwise, and of course, those contact points for Holly and her team. Again, over at passionatepioneers.com. Well, Holly, we have one more piece for you. We'll get you out of here so you can keep building some new, innovative ways to deliver that value in the marketplace that is so desperately needed. But before we get out of here and allow you to go get back to it, we have a fill in the blank. I'm a passionate pioneer because
I believe in the power of electronic health records to help give better tools to clinicians to take better care of patients and have better outcomes overall for Americans.
Yes, 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 and yes. Thank you so much for that, Holly. You brought it home. This was a wonderful conversation. Thank you for taking time and spending time with our community to share what you and the Clinicomp team are doing right now and where you are heading. And of course, we'll be continuing to stay abreast of your journey. Maybe have you back for a Where Are They Now conversation in the future. But of course, for now, Holly, again, thank you so much for being with us today.
Oh, thanks for the opportunity. Really enjoy the conversation.
Thank you for joining us today on Passionate Pioneers with Mike Biselli. We'd love to hear your feedback about the podcast so we can continue to improve this community and to further support the pioneers being featured. Lastly, please take a moment to subscribe to the podcast and invite your friends and colleagues to join us. This is Passionate Pioneers with Mike Biselli. I look forward to having you back with us during our next episode.